COVID-19 the source of your distress? Individuals with sickle cell are a particularly vulnerable group of patients with a higher risk. You guys already know this, with severe complications than the general public. The sickling is triggered by events such as viral illnesses, cold weather, stress, low oxygen, among others. If this sickling happens in the lungs, it triggers a cascade of events. And I don't know whether you guys have experienced any of your people actually being diagnosed with COVID 19. Now, combined with the original respiratory infection in a person with sickle cell, it is called acute chest syndrome, is one of the leading causes of death in people with sickle cell. And so if you contract the coronavirus, that means that you're simply at higher risk. And so let's get through this slide and I'll tell you about the next one. Let's see. Go to the next one. Okay, go through this. Skip about the next three slides. They actually are about risk factors for disease. Okay, that was, and we've actually come, we got about 2 more minutes. And so I'll just tell you that the last 3 slides were about the high incident rates of suicide among teenagers. You guys, we've got to be concerned about this next generation. You know, it's our responsibility to care for them, to teach them, to mentor them, to help them get help. And we can pretty much tell, you know, some of you on the call are mental health professionals. And so you can recognize a person. It's funny, you know, I can talk to a person for about 15 minutes and almost diagnose them right at the time that I'm talking to them, just based on what I'm hearing come out of their mouth. And so when we, again, this last thing I'll say before we open it up for question and answer, and you guys, those of you that can see the screen, there is my information that that you can get from the screen. It has my website on it, drgayle.com, and also my phone number, 678-521-8448. My latest book you can get from the website is The Whole Soul, and it actually talks about how you change your thought patterns. We've got to learn, you know, and even as I have walked with a focus on God for 40 years of my life, I still have to change my thought patterns. When I looked at the first stages of the COVID-19, before it ever was released in America, and I was looking at China, I was looking at the other countries where, and I was thinking that's about to come to America. And Lord, what kind of effect will it have? None of us had a clue that we would be so affected. And what I began to look at is that a worldwide epidemic had literally, and that's what they're calling a pandemic, it literally shut down the entire world. Well, for me, because I'm a believer, I went to prayer immediately. I knew nothing else could help. I began to read the scripture. I began to ask God, what was he saying to us? Now, many people would say, well, why would God allow this to happen? Well, there's more than just God that operates in the universe. There is another spirit that operates in the universe. And so you really just kind of have to ask yourself, what do you believe in? Who do you believe in? What is it that God may be saying to you? Or it may not be God. It may be your higher power. Whatever it is that you believe in, what is being said in this hour? What is being said in this season? And that little bitty things that we have not been able to do, little bitty things for us girls, like getting our toenails done, getting our hair done, little bitty things that we've taken for granted, or even little bitty things that we have used as idols. So the bottom line is anxiety, fear, stress, and worry is real. Chemicals in our brain is real. And all we have to do is we've got to learn how to manage those things, whether it's managing the chemicals, whether it's managing the emotions. We have to learn. In other words, you guys, we have to take authority over our destiny path. Every one of us has a destiny. We have to take authority over everything in order for us to walk in the destiny path. Whether we live to be 20, 30, 70, 80, 90, 100, however many years, God sent us as spirit beings to the earth to complete an assignment. What is yours? Will you complete it? And whatever it is that you've got to do, make sure that you do it, that you're walking out your destiny path because you're in control. With that, I'm going to turn it back over um, to Dominique and Dr. Bailey, or whoever is in charge at this. Thank you all. Thank you so much for advancing the slides. I don't know why they froze up on me.
It's not a problem. Thank you very much. That presentation was amazing. I am going to stop sharing my screen right now, and then we are going to go to some questions. So does anyone have any questions? We have one that says, please can you use the scriptures I needed in my tough times? Thank you for putting up another scripture. I feel so much better. So the scriptures in your presentation has been doing amazing.
Oh, it's me. I wrote it, Sarai. Yes, doctor. Thank you because last Sunday I just lost my uncle. As we don't know the results yet through the autopsy. But yeah, those were making me feel better during the presentation as I was going through sadness for 2 days.
Now, you said you just lost who?
I lost my uncle last Sunday.
Okay, okay. I'm sorry to hear that.
It's okay.
And glad that the scriptures were significant for you.
Yes, they were.
I know that during this time with the having to stay in, anxiety levels could get very high. I know my anxiety level got a little high a few weeks back because I ended up just having a regular crisis attack. And the first day I was fine, but by the second day, I started to freak out and my anxiety level spiked so high. And then by the third day, I was in a full out panic fear that I had contracted COVID-19 and that I was going to die from it. Can you suggest some things that some coping mechanisms that may help us cope better with our anxiety and fear about this whole COVID-19, or how to keep our anxiety levels down during this?
Some things that I learned, and maybe 30 years ago, I was principal of a Christian school. And that was the first time that I recognized stress on the first day of school, and just running around like crazy trying to make sure that everything went smoothly. And I began to feel like I had these tight rubber bands just pulling tight around my head. and they continued to tighten. I don't know that I knew that it was stress right then, but I did learn how to quiet myself down. And that was by just taking some time. I closed my door. And I remember reading a book, I was sharing this not long ago, of 30 Golden Minutes during that time. And the author suggested that even if you don't take a nap during the day, but that you find a spot that you could just be quiet for 30 minutes, that would help. Over the years, what I have learned, and every now and then, this is how I know when I'm stressed. And I know stress is a little different from anxiety, but they all play in the same pot. Um, when I go get chocolate and I go shopping, I know that I'm stressed. And so when I discovered that a few years ago, I discovered, okay, so if I felt the urge to go um, shopping, then I'm not saying that stress automatically causes shopping. I mean, I like to shop anyway, but I learned how to, and I think I mentioned this earlier, going to the chiropractor and going to the massage therapist. The massage therapist, and I've been getting massages for about 30 years, has been the best therapy medicine for me. Um, it relaxes my muscles, it quiets my mind, and that's really what I'm doing, or telling people that we should learn how to do is quiet the mind down. Now, of course, I do a lot of spiritual things as well. I pray in the spirit, I sit quietly and read the Bible. But you've got to learn how to relax yourself. If you can't do that, then life itself will always be the anxiety trigger because there's always something going on. And so, um, going to a therapist, letting a therapist help walk you through whatever exercise, listening to quiet music, meditating. Meditating is an excellent tool. And what I do is I've gone on YouTube and found various music, soft music, meditative music. In fact, I turn on my TV even when I see my mental health clients when they come to my office. I turn on the TV screen, go to YouTube, turn on meditation music. I either put the diffuser on, typically the diffuser with essential oils. There's various essential oils that are relaxing, particularly lavender is one. It's my favorite. Frankincense and myrrh is another good one. When my husband was very ill, I diffused that through the house 24/7. So if you can find the soft music, find the quiet spot, talk to yourself. Begin to speak to your brain. Begin to speak to your subconscious. Begin to say, I command you. See, because we're in control. Begin to say, speak to your brain and say, I command you to line up. Just begin to speak um, words that you know that calm you down. That's just some of the techniques that I use.
Oh, thank you. Do we have any other questions?
Hi everyone, it's Lakeith, Dr. Bailey, and tomorrow we're also going to follow this up with a panel at 7 p.m. with Dr. Gayle, but also with sickle cell patients, warriors who have dealing with anxiety and fear. And we're going to start with a panel, but open it up to general discussion about different things that we're doing, like speaking the positive words, finding the quiet place, different things you can do in isolation to help with anxiety and fear. We do have one question, but it is involving a question regarding taking supplements. And we are going to ask that any question regarding medication, supplements, anything of that nature, that you take that to your doctor. We are presenting this information not as medical advice, but as a place for us to talk and to generally discuss these things. So anything regarding that, we are going to ask that you take those type of questions to your individual physician. Tomorrow, I'm looking forward to sharing some information because I didn't realize that I dealt with so much anxiety. It never occurred to me that what I would experience, the sudden panic, the increased heart rate, well, the anxiety was in fact a mental illness condition. I just knew that I was anxious. And so I was actually very recently, I think it's been in the last couple of years since we started working with Dr. Gayle and other mental health experts, that I began to recognize the symptoms of anxiety and realize that, oh, okay, this is anxiety. This is a thing. So we'll be talking a little bit about that. I am one of the panelists tomorrow, looking forward to talking about that. And anyone else that wants to come on, hear tips or share tips tomorrow, please come do that. Dr. Gayle is going to moderate for us tomorrow as we have that discussion with Alexis Wardlow and Jewel Darbonet. If there's anyone else that wants to be part of that panel and share, please reach out to someone on the mental health initiative. You can reach out to me or Jewel or Clayton Andrews to get you on the panel. That looks like that is the only other question that we have in the written chat here and on the chat online. We are going to stop sharing the Facebook Live now. Anyone who is still here, you are welcome to join us on the WebEx. We're going to stop sharing the Facebook Live. And for the few here on the WebEx, if you have a question, please come on and join, and you can ask it without being concerned that it is also being shared to anyone on